Have you ever gone to your doctor and they say to you, hey, I just got your labs back. Maybe you are what is considered a pre-diabetic. And they may make recommendations. Hey, go watch what you eat, go lose some weight. And with the hopes that you don't actually become a diabetic, because diabetes is very serious. It's a chronic degenerative disease that causes many complications. But what is exactly pre-diabetes, right? So what's the thing, right? So in this video, I'm going to be talking about pre-diabetes. What exactly does it mean? What to do about it? And give you some insight on whether or not it makes sense to actually take this real serious or don't worry about it. All right, so here we go, showtime. So the first thing we look at is prediabetes, right? What exactly does that mean? Is this something that we should be concerned over? So, there was a famous comedian back in the day. His name was George Carlin. And George Carlin was talking about there's no such thing as pre, right? So he would go on, it's really funny, actually. He talks about what is pre-boarding a plane, right? What is preheating an oven? It's either heated or it's not heated, right? It's like boarding a plane. Either you're boarded the plane or you're not, right? Like, there's no pre-boarding. And it's pretty funny. And that's kind of how diabetes is as well, right? There's really no such thing as pre-diabetes. So let's get into this because this sounds controversial. So here we go. So the first thing we look at is normal sugar, right? Now, there is a normal sugar based on our human physiology. All right, let's talk about what that is. So the first thing we look at is we look at glucose, right? So glucose should be between 85 and 99. That is where healthy blood sugar is. Most of the time I tell people that, hey, listen, your blood sugar should be almost the temperature of like a hot tub or a shower, right? Like, you don't want a hot tub to get too hot or you'd burn your skin off. And same thing, right? Like, you want to be kind of comfortable. And that's really ideally where you should be. That's kind of the way I think of it, right? Like, what's a temperature that's really a good temperature? So 85 to 99 is where that should be. A1C should be under 5.7. So A1C is kind of like not a day-to-day number, but it's an average over a number of weeks. So this is really important to understand because you want to know what actually normal is, right? So the next thing we look at is what is pre-diabetes. So basically, well, type 2 diabetes is glucose over 126 and A1C over 6.5. So play along. If your glucose is higher than 126 and your A1C is over 6.5, they now label that as a type 2 diabetic. This is where you get the label. This is where if you go to your doctor, most of the times they'll give you some sort of a diabetic medication, metformin, glipizide, glyburide, Januvia, Genumet. When I first started helping type 2 diabetics, I don't know, 20 years ago, there's probably about 10 medications. Now there's like 50, right? Like, they've added more and more medication, right? There's a big industry. So anyway, when we go to type 2 diabetes, we're looking at anything higher than 126 and A1C over 6.5. So the question is a pre-diabetic healthy, or are they just not really, really, really sick? And that's, I guess, the viewpoint we look at. So as a type 2 diabetic, you have a known disease that's really sick, whereas a pre-diabetic, you're trending there. Now, the way I like to look at it, and I'll refer back to this in a moment, is it's kind of like a car tire. So a car tire should have the right amount of pressure in the car tire. No one wants a partially deflated tire, and certainly you don't want a flat tire. So when we look at it, it's kind of like, well, if you want your body to be healthy, well, we need all the tires to be fully inflated and functioning and doing well. Whereas a pre-diabetic is kind of like, hey, you're not, fully sick, right? You're not fully inflated, but you're not flat either. And I don't think that's a good place to be. I think optimally where your body is functioning correctly is where you should be. So the viewpoint we look at is, are you healthy or not really sick? And the point is that you're certainly not healthy, and yeah, you're not really sick. You may be trending that direction as a pre-diabetic. And it's almost like, and I've heard patients say this, like they were pre-diabetic, and the doctor's just kind of looking at their watch like, well, give it some time, you're going to be a diabetic. And that's because obviously in our healthcare industry, no one's addressing the root imbalances. No one's fixing why the blood sugar levels are an issue or the metabolism is broken and so forth, right? That's obviously what I've been doing with functional medicine for 20 years is you got to find the root imbalances, right? You got to get the organs working. And when you do that, that's how the person gets better. So anyway, we look at healthy or not really sick. So is this healthy is the question, right? Glucose, all right, if it's between 100 to 126, this would be that pre-range. Is it healthy? No. If your A1C is from 5.7 to 6.5, is it healthy? No, right? This is kind of like you're not really sick. It's kind of like that deflated zone. You're not really sick, but you're also not healthy. So once again, the goal is to get to healthy blood sugar between 85 and 99 fasting, right? That's in the morning. And then A1C under 5.7. That is where you should be. Okay. So once again, when we look at this, are you healthy or just not really sick, right? You're either healthy or not. So when you come to being a pre-diabetic, you're trending. It's kind of almost a warning sign. It's almost like a car tire again, right? If it starts deflating, well, I guess you could wait till it's fully flat, which would not be a good idea. You get into an accident, or even worse, right? Your car gets destroyed, or your rim gets destroyed. And I don't think that's the right way of doing it. I rather, like patients in my office, we go after being healthy, getting the body functioning optimally so their body could heal and do well and so forth. So is there such thing as prediabetes? Not really. It's either you are really healthy or your body is out of balance and it is not. All right. So I hope you got a lot of information on this. If you have any questions, please comment and or send us a message about it. All right. Thank you and have a good day. And remember, be healthy. Don't be pre anything. And if you have a chance to, definitely watch that George Carlin skit. It's pretty funny. All right. Take care.